Here today. I'm Annika Izagiri. I'm Communications Director with the Committee to Protect Healthcare. I'm honored to kick off this important conversation this morning and to be joined by three Arizona physicians, Dr. Paul Isaacson, Dr. Patricia Levinson, and Dr. Laura Mercer. Before we begin, I would like to state that these physicians are speaking as individuals and not on behalf necessarily of any employers or other affiliated organizations. So we ask that you please only refer to them in your coverage as they introduce themselves on the call today. Thank you in advance for being respectful of that. Doctors, thank you all for making time today to share your expertise on why Proposition 139 is so important for reproductive health care in our state. We're going to start with some remarks from each of our guests, and then we'll have some time at the end for questions. Dr. Levinson will be delivering her remarks in both English and Spanish, and she'll be available to answer questions in Spanish during the Q&A portion. If you would like to answer a question, please send it to my personal chat through Zoom so I can easily compile them. Please also include your name and your news organization so that I can sort through and help compile them in a timely fashion. We'll answer as many of those questions as we are able to after the physician remarks. So without further ado, I will introduce our first speaker, Dr. Mercer.
Thank you, Annika, and thank you all again for being here today. My name is Dr. Laura Mercer, and I am the immediate past chair of the Arizona section of the American College of Obstetricians and Gynecologists. I practice general obstetrics and gynecology here in Arizona. And while my primary clinical home is in Phoenix at the teaching institutions here, I also help cover in maternity deserts in rural parts of Arizona, both down at the Mexican border and up on the Navajo Nation in northern Arizona. This gives me a unique perspective across many care settings in our state. I'm also a native Arizonan, born in rural Arizona in a copper mining town, and I've lived here my entire life. Though there are just three physicians on the call today representing the medical community, I want to emphasize that we are not alone. In fact, more than 550 medical professionals in Arizona support Proposition 139, and there are many reasons why. We know of Arizona women who have gone to the emergency department with serious conditions only to be told that they will need to wait in their cars and come back when they are more sick. So sick that they're about to pass out or are unequivocally having major complications. And unfortunately, this really isn't an exaggeration. This is literally what healthcare looks like in Arizona with our current abortion ban and the confusing laws. Current laws, in fact, that are so unclear that different doctors are getting different advice from different lawyers in different hospitals, all under a threat of prison time, not just a lawsuit, if somebody disagrees with their care. This is why politicians just shouldn't be involved in making these critical healthcare decisions for women. Healthcare is too complex, nuanced, and individualized to be legislated with broad strokes. Prop 139 guarantees the right to an abortion and puts healthcare decisions where they belong, with the patients, their families, and their healthcare providers who are highly trained to provide reproductive healthcare. It does not remove evidence-based medical safeguards or safety precautions for obstetrics or abortion care, nor does it change the requirement that abortion be provided by licensed, qualified healthcare professionals. Physicians and healthcare professionals, like each of us, always put the safety and well-being of our patients first. We get to know our patients, oftentimes over many years, learning about their unique health conditions, their concerns, and their hopes. Doctors know too well how personal our patients' decisions around pregnancy and abortion can be. As an OBGYN, I've witnessed both heartwarming and heartbreaking situations involving my patients' reproductive health. In all cases, I've respected their privacy and their autonomy, and I've worked with them to protect their health and well-being. I sincerely urge all Arizonans to join me in supporting Proposition 139. And it's now my pleasure to pass the floor to Dr. Patricia Levinson.
Thank you, Dr. Mercer. Good morning, everyone. My name is Patricia Levinson. I'm a family physician in Tucson, Arizona. I've been a family physician for over 30 years and taking care of families, including doing prenatal care and delivery. And as Dr. Mercer mentioned, Arizona's abortion ban is having dangerous consequences right now. Arizona's abortion ban fails to protect victims of rape or incest who could be forced to have their attacker's child. These are personal and private decisions that should be left to women and not the government. But politicians have taken away women's freedoms to do so. Think about what this means for women. For example, Nicole was raped at 11. Like many girls at that age, she didn't understand the signs of pregnancy. Once her mother helped her figure it out, she was able to get Nicole the care she needed. But under Arizona's current abortion ban, a survivor of rape like Nicole might be denied an abortion, putting her young life at risk as well as her health. For example, another story of Jennifer, who was raped at 14 by someone she trusted. She was understandably too confused and scared to seek help for several weeks. So, under Arizona's current ban, it would have been too late for her to get an abortion, no matter what she and her family thought was the best for her. I understand there are differing views on abortion, but we can all agree that no one should be forced to carry their attacker's child. Nobody needs to abandon their faith or deeply held beliefs about the sanctity of life to agree that this abortion ban is dangerous. Here in Arizona, we can all agree that women, along with their families, deserve the freedom to make their deeply personal decisions about pregnancy without judgment or political interference. As a healthcare provider, I feel very strongly that we should trust women to make their own personal healthcare decisions. There are deeply personal reasons why someone may have an abortion, and Arizonans deserve the right to make those decisions free from government interference. I'm going to do the same words in Spanish. Me llamo Patricia Levenson, soy médica de familia y he practicado medicina familiar en Tucson, incluyendo trabajo con mujeres embarazadas y en la sala de parto. Como la doctora Mercer mencionó, la prohibición del aborto en Arizona está teniendo consecuencias muy peligrosas en este mismo momento. La prohibición del aborto en Arizona falla en proteger a las víctimas de violación o incesto, quienes podrían verse obligadas a tener el hijo de su agresor. Estas son decisiones personales y privadas que deberían quedar en manos de las mujeres y no del gobierno. Pero los políticos les han quitado a las mujeres la libertad de hacerlo. Pensemos en lo que esto significa para las mujeres. Por ejemplo, Nicole fue violada a los 11 años. Como muchas niñas de esa edad, no entendía las señales del embarazo. Una vez que su madre la ayudó a darse cuenta, pudo conseguir la atención que Nicole necesitaba. Pero bajo la prohibición actual del aborto en Arizona, una sobreviviente de violación como Nicole podría ser negada un aborto, poniendo su joven vida y salud en riesgo. También está la historia de Jennifer, quien fue violado a los 14 años por alguien en que ella confiaba. Naturalmente estaba demasiado confundida y asustada para pedir ayuda durante varias semanas, así que bajo la prohibición del aborto en Arizona, ya habría sido demasiado tarde para que pudiera obtener un aborto, sin importar lo que ella y su familia consideraran lo mejor para ella misma. Entiendo que hay diferentes puntos de vista sobre el aborto, pero todos podemos estar de acuerdo en que nadie debería ser obligado a llevar en su vientre al hijo de su agresor. Nadie necesita abandonar su fe o sus creencias arraigadas profundamente en la santidad de la vida para estar de acuerdo en que esta prohibición del aborto es peligrosa. Aquí en Arizona todos podemos coincidir en que las mujeres, junto con sus familias, merecen la seguridad de tomar decisiones personales sobre el embarazo sin juicios ni interferencias políticas. Como proveedora de atención médica, creo firmemente que debemos confiar en que las mujeres tomen sus propias decisiones médicas personales. Hay razones profundamente personales por las cuales alguien podría optar por un aborto. Los arizonenses merecemos el derecho de tomar estas decisiones sin interferencias del gobierno. Muchas gracias. And now, Dr. Isaacson, over to you.
Thank you so much, Dr. Levinson, and good morning. Excuse me. My name is Dr. Paul Isaacson. I've been an OBGYN for over 30 years, and for the last 20 years, I've been a full-time abortion provider in Phoenix. Over the last 20 years, I've watched as the state of Arizona continually chipped away at abortion rights. It seemed that each legislative session brought some new restriction or ban that made it more difficult to access reproductive health care. But when the Supreme Court overturned Roe versus Wade, the situation in Arizona became extreme. Arizona's abortion ban is actively putting my patients at risk. Patients and doctors are being put in unacceptable, dangerous positions. For example, if a patient is 16 weeks pregnant and her water breaks, she loses the amniotic fluid. And without the amniotic fluid, the fetus will never be able to survive. Meanwhile, she's at risk for a life-threatening infection that antibiotics can do nothing to help. Yet Arizona's ban threatens me with prison if I do help. Doctors like me are forced to ask, how close to an emergency or death must a patient be before I can intervene? Should I use my medical expertise to protect her health, her life, and her future fertility, knowing that a politician or a prosecutor with no medical knowledge may disagree with my decision? Should I try and get her on a plane to another state where she can access care? What if she gets sicker or she dies on the way? How can I live with that? How can her family live with that? Doctors have years of medical training and experience that politicians don't. That's why Arizona politicians have passed laws that have no basis in medical reality, that impose arbitrary bans with no scientific rationale, and that put Arizona patients at greater risk at all stages of pregnancy. Every pregnancy is different, and extreme bans deny the reality that patients and their providers deserve to navigate serious healthcare decisions for themselves. Prop 139 is based on the very Arizona idea that people have the freedom to make their own healthcare decisions without government interference. It will put an end to Arizona's dangerous and devastating abortion ban to ensure a patient's needs, not politics, drive important medical decisions. Thank you for your time and for covering this important issue. And
Thank you. And Dr. Levinson is going to recap some of the additional remarks in Spanish.
Para resumir algunas de los puntos que tocaron Dr. Mercer y Dr. Isaacson, voy a resumir esto en unas palabras. La prohibición del aborto no ofrece protección para las víctimas de violación e incesto, como dije yo, dejando a sobrevivientes como Nicole, quien fue violada a los 11 años sin acceso a la atención esencial. También pone en peligro pacientes con embarazos no viables, como cuando se rompe la fuente a las 16 semanas, poniendo sus vidas a riesgo mientras los doctores temen enjuiciamiento por intervenir, como dijo el doctor Isaacson. Estas leyes impulsadas por políticos sin experiencia médica ignoran la ciencia y aumentan los riesgos para las pacientes embarazadas. La proposición 139 restaura el derecho al aborto, garantizando que las decisiones médicas, personales, sean tomadas por las pacientes, las familias y los proveedores capacitados y no por el gobierno. Muchas gracias.
Thank you, Dr. Levinson, Dr. Isaacson, and Dr. Mercer, all for sharing your perspective on why Proposition 139 is so important for reproductive health care in Arizona. As I mentioned before, we will take some questions now. If you have a question for one or any of the physicians, please chat that question to me so I can help compile them. If the question is in English, I will be able to read it for one of the physicians to answer, or if it's in Spanish, I will direct it to Dr. Levinson to be able to respond to that. So I'll allow a few moments for folks to be able to start typing those questions. Not seeing any yet, but we'll allow a couple more moments. Oh, the chat might not be working, so I apologize if that is the case. If it is not working and you're trying to send a question, please send it in the Q&A and I will help try to compile it that way. So I apologize about that. I'll also say in the meantime, we have been recording this webinar. So if you'd like a copy of the recording, or if you have any questions that you'd like to ask after the call is over, please let me know and we can help arrange that. I'm putting my email address in the chat. Okay, well, I am not seeing any questions. So Dr. Levinson, Dr. Isaacson, and Dr. Mercer, you have all been extremely thorough. Thank you all for sharing your perspective and your stories. It's a very important time. So we appreciate your time today and your advocacy on behalf of Proposition 139. Again, to the media who joined, thank you so much for joining. I apologize if there were any issues with the chat, but again, please follow up with me via email if you have follow-up questions or would like a copy of the recording. And thank you all again for joining. Thanks everyone and have a great rest of the day.
Thank you. Bye-bye.
Thank you. Thank you for the opportunity. Bye-bye.
Thanks everyone. Thanks. Bye.